Hey, this is Dr. Johnson. A lot of our patients have questions about flexor tendon lacerations, so I put together this video to help explain how we examine a hand and determine if surgery is needed. The flexor tendon examination is quick and easy. It gives us a lot of useful information. The first step is just looking at the natural cascade of the hand. By cascade, I mean how the fingers relate to one another. There should be a slight bend to each of the fingers. The middle finger should be flexed slightly more than the index finger, and the ring finger should be slightly more flexed than the middle finger, and so on. Next, I ask the patient to make a fist. The finger should come down into the palm in a nice, smooth, natural way. If one finger remains straight, as in this photo, or it cannot come completely into a fist, I make a mental note to pay close attention to that finger. Next, in a step-by-step manner, each finger is evaluated. Generally speaking, each finger has two tendons that allow it to bend. There is one tendon that goes all the way to the tip of the finger and another that stops in the middle. To test the tendon that goes all the way to the tip, you prevent all the joints of the finger from moving except the last joint of the finger. If the patient can't move the tip of the finger, then you know that the tendon that travels to the tip has been cut. There is another tendon that stops about halfway down the finger. This tendon is a little trickier to test for, but using a trick of anatomy we can isolate this tendon. If you keep all the fingers straight, you'll notice that the finger that moves bends only in the middle and not at the tip. So combining these tests, we can determine exactly which tendons have been cut and then plan your surgery accordingly. And that's it, not too complicated. You can test it out on yourself or a friend. I hope you guys learned something, and I hope you enjoyed watching this video. As always, please feel free to contact our office with any questions or visit us at dominionplasticsurgery.com.